Hi, my name is Karen Zaneta and I am one of the instructors for invasive nursing therapies. Today I am going to give you a demonstration on IV insertion, and then when we're done with that we'll go to an IV discontinuation. We're going to just be putting in a saline lock because when you are needing to put in an IV, you're going to find out what your patient needs the IV for. Is it for a lot of fluids? Is it for antibiotics? What is it for? In this case, all we need is a saline lock. We're not going to put any fluids into it. So the first thing I'm going to do is come and see what the patient has for veins. Put the tourniquet on and make sure you know how to put a tourniquet on well. And then you're going to be starting, distal to proximal. So you want to start down at the hand if at all possible, because once you wreck these veins, you can't use any of the veins down here. That's why we start down here. You want to get a vein that's bouncy, that's not all sclerosed, that has at least, like a couple finger lengths. So I'm going to try and go for this one right here. So I'm going to take the tourniquet off, and the next thing I want to do is prep the area. So what I would suggest you to do, and this is just a suggestion, is that if you're wanting to mark your site, get your ChloraPrep and then take the very end of it and then go down here and mark where you think the insertion should be. And so on an actual person, you'd see like a little indent. So now I'm going to go ahead and then I'm going to clean the site. Now since it's ChloraPrep, you don't have to do the circle thing like you do with alcohol. So you can just go back and forth, and you want to clean that really, really well. So we're going to say that I've cleaned this for at least 20 to 30 seconds. It's good and clean. While it's drying, I'm going to get the rest of my supplies ready. So I am going to get my IV cannula out. And it's okay, it's got a cap on it, so you can go ahead and put it on there. And get my 2x2 ready. I'm going to get my saline lock or my extension tubing ready. I'm going to get my flush ready. 10 mils flush is what we need. And I'm going to prime. So just put it together and then just go ahead and prime the tubing. It is essential that you do this. And then I'm going to just loosen the cap. Once I've loosened the cap, I'll put it back in there. So the cap is still on. I think I got everything ready to go. I've got 3 pieces of tape here just in case needed. You're going to need 2 for sure. I do 3 just in case. I am got a new set of gloves on, if we can go with that. I've got it marked. It's been prepped. I'll go ahead and reapply the tourniquet. And keep in mind too, if you're having trouble viewing a vein, when you were first getting ready, if you wanted to hot pack it, you can hot pack it. You can have them make fists. You can have them put their hand below the level of the heart. There's a lot of different things that you can do. Tapping of the vein. But all that you would do prior to cleaning it. But we had luck. We found one. We're good to go. I'm now going to get my cannula. When you're doing cannula, with these type of cannulas anyway, there's little ridges on the side here, and that's where you're going to put your 2 fingers. And technically, there's a little doohickey right there, and that's what you use with your pointer finger. So make sure the needle is there. Don't try and start it like that. It won't work. So keep it back. So I always try to think of it as a race car. So now the other thing is you're going to use, I'm right-handed, use your left thumb, and you got to keep that vein taut so that it's straight, so it won't roll. And you start at about a 30 degree, no more than a 30. And then you're going to go into the vein, and then of course you would get flashback. Go in just a little bit further to make sure you're good and secure, and release the tourniquet. Then there isn't so much pressure. Come back and get the tautness, and then you're going to start pushing and pulling back at the same time. Now we're going to say, you stay very still, and I'm going to get a piece of tape here. I'm just going to put it right there. The trick with this is you don't want the tape to be right at the insertion site, and you don't want the tape too close at the end of your hub, or you're going to run into troubles. So I've got that. The next thing I would need is a Tegaderm. Taking my Tegaderm, make sure that you just peel, and when you take a look at it, you'll see that there's a little crease here, and that's so that it molds on the hub. So put the crease down even with your tape. And then you can take this little part off. It sticks better on skin. Okay, you're going to be using this later, so do not throw that part. The next thing I'm going to do is take my 2x2 and carefully just hold on to the edges of it and bring it underneath here. And that's just going to act as, if blood drips, it's going to catch it. Next thing we do, take the cover off and just hold it like this. Now the essential part again is you got to block the vein, because if you don't occlude this vein and you take this off, blood's going to be coming. So you occlude the vein and then you hold the hub with your other finger or whatever works for you. Then take it off and quickly put your extension tubing on and then put it on. Make sure you hold your hub when you're putting the extension on, otherwise it'll be like a screwdriver effect and it's not good. So we're done with the 2x2. Now, if it were an actual vein, you would aspirate, and you just got to see a little bit of blood come back here just to assure you're in the vein, and then you would go ahead and flush with the entire 10 mils of the saline. Take another piece of tape, and we're not so fussy about this one because the insertion site's covered. And there we've got it in. Then, like I mentioned earlier, on this part here, you'll go ahead and put the date. And it's just like a little piece of paper tape is what it is. And I like to put them on the side so that it doesn't obscure the view. So now we've got it ready to go. So 2 pieces of tape, Tegaderm, the extension, that, and tourniquet we don't need anymore. And if, obviously you would then go into your electronic medical record and chart accordingly where the site was, what size did you put in, which gauge, how many attempts did it take you? Did it take you 1 attempt? Did it take you 2? And if you hung any fluids, anything of that sort, you would go ahead and chart. So we're going to say that this patient is doing pretty well. Time has passed on. He's eating a clear liquid diet and he's tolerating it well. He's got bowel sounds, he's passing gas, there's no nausea, and he's probably going to be going home maybe tomorrow. The doctor came along and said to just discontinue all IVs, the IV fluids, the IV antibiotics, everything. So that's what we're going to do next, is DC the IV. There isn't too much that you need for that, but I got my tape ready to go in 1 piece of tape. I do need a 2x2, and I need a pair of gloves. So the first thing I would do is that we need to take off what we put on when it was started. So just start taking off some of the tape. There's really no nice, pretty way to do this, but you just get it going with your hand versus with the gloves, and it goes a little bit easier. So just peel it up to the site. Don't expose the site quite yet though. Okay, I think we got it. Now I'm going to put my gloves on. Okay, I've got my 2x2, and I think I'm just going to double it like this. Now I'm going to bring all this up. I'm just going to hover over it, and then I'm going to take it out, and then I'm going to put pressure Don't put pressure until the cannula is all the way out, and then always take a good look at the cannula. Make sure that it's looking fine and that there's no parts missing or if it was bent, anything of that sort. What you can do now, because we kind of want a pressure dressing on this, because otherwise they're going to bleed, especially if they've been on Coumadin or Plavix or aspirin or heparin, anything of the sort. So put a pressure dressing on there. I would go out of the room and I would document, obviously, what I just did about taking it out, what size it was, what did the site look like, and then what I would do after I'm done charting is come right back into the room to make sure they haven't started to re-bleed. Even if a person isn't on a blood thinner, they can start bleeding afterwards, especially if you didn't put that dressing on nice and tight. So make sure you come back in the room, double check that it's doing okay, then you can go ahead and go on your merry way. So I think that covers it as far as putting an IV in and taking an IV out.